It's a great pleasure to welcome up as our next two speakers, who are both with Eastland Community Trust and are going to talk to that subject, Audine Grace-Kutia and Erina Hurihanganui. So a very warm welcome to them both, please. Thank you very much indeed.
Ngā mihi kia koutou, ko Audine Grace tōku ingoa, no Ngāti Porou, no te aitanga maha ki hoki, tēnā no tātou.
Tēnā koutou katoa, ko Erina Hurihanganui tōku ingoa, I te taua tōku koka no Ngāti Porou, ko tōku pāpa no te arawa, tēnā koutou katoa.
Kia ora everyone. Okay, I'm the manager of community engagement at the Eastland Community Trust, and our kōrero today is to share with you an exciting piece of work that we've embarked on at the Trust. We deem it to be the most important piece of work that the Trust has carried out in its 25-year history. Tū ora ai tātou, living well together. As a result of 10 months of research the Trust has worked on to understand and develop Tairāwhiti Wellbeing. We want to be able to apply this to our funding distributions and investments, both the front end and the back end. Okay, so first of all, a bit of context as to ko wai mātou no hea mātou, who are we and where have we come from? Most of you will recall the 1980s and the deregulation of the electricity networks or the power boards, as most will remember. It was in the early 90s whereby the ECT was formally established with the trust deed that still guides us this day. This saw the formation of the Eastland network in 1993, and in 2003 the Gisborne Harbour Board, now known as Port Eastland, changed hands to Eastland Group Limited from the Gisborne District Council. It was some 20 years later before ECT embarked on its first type of community engagement in an effort to formulate a distribution strategy. That was to help inform the decision-making of the Trust around how distribution, funding and investments were made. In retrospect, it was probably a light touch on where we're at today. What we saw prior to this strategy being created was a total of 25 million distributed in the first 20 years. So that was roughly just over $1 million a year. And that was towards local Tairāwhiti initiatives and business. Fast forward to 2015 to 2018, with a new distribution strategy in place, the Trust moved a lot more funds into the community with somewhat better thinking, with just under 22 million over a 3-year period. In the last financial year, just up to March recently, 2019, the Trust has endeavoured to up its game and think more in the wellbeing space, with $16 million being dropped in the community towards local initiatives and business. Some other notes of significance up there in our whakapapa has been the merger of new activities into the Trust, which have led me to our next slide in terms of how we're made up. So as determined by the Trust deed, the 1993 Trust deed, the capital beneficiary of the Trust is the Gisborne District Council, who we have an MOU with. ECT is the major shareholder. I'm going to sort of come to the right of the structure there. Major shareholder of Eastland Group Limited, so you'll be familiar with the local infrastructure company that overarches the Eastland network, the port and airport activities, and also some geothermal interests that we have in the company. We also have, alongside EGL, other investment operations with Prime in sawmilling and wood processing, being a wood cluster, land and buildings, and also the Eastland Development Fund, which was established as a base for local business activity at Commerce Place, and includes wood engineering technology. The other activities many of you will be familiar with in isolation of ECT are Activate Tairawhiti, local tourism, the city centre vibrancy activity, formerly known as Heart of Gisborne, and basically what we've done there is brought them all under one umbrella into our whānau, and we're in the throes of undertaking a rebranding exercise to remove the singularity of what they were formerly known by. So some of you may ask, why Wellbeing? At the beginning of 2018, trustees, and I acknowledge two of them here today, Jill and Elsa, amongst us, trustees in their strategic review decided they wanted to have a more significant focus on the wellbeing of our region. It was at this point the Trust launched into this work to engage far, deep and wide within the Tairāwhiti rohe. Our Living Well Together Tu Ora Ai Tātou catch cry describes where we want our community to be. The three drivers of that are community engagement, to create a wellbeing framework, to help inform a decision-making tool, and thirdly, to develop an impact measurement tool. What relevance, you might ask, do we have to the circular economy? We firmly believe our wellbeing initiative links strongly to the outcomes sought with a circular economy. In our research, and it's commonly well known that GDP is a consumptive measure, loves fossil fuels, relies on events such as the boulders of this region, the earthquakes of Ōtautahi, and the like. Our research has also told us that Māori worldviews of kaitiakitanga and indeed Indigenous worldviews around connections to land are lacking in the models that we've examined. Our engagement hopes to capture these worldviews, and some of our preliminary feedback is that Māori have been practising this notion of circular economy or kaitiakitanga for centuries. So all of that we're going to be taking on board. What is out there? It was February 2018, we commissioned Dr. Bridget O'Brien, a public health doctor, to undertake a literature review for us, and she did a horizon scan of wellbeing frameworks. 57 national and international frameworks were explored and examined. This framework supported us with coming up with a suggested definition and set of possible domains, determinants and measures. Okay, so what you'll see up there is probably the 57 frameworks, which is all compiled into a 50-page document on one page. So a splattering of what we've managed to come up with, and basically a starting point for us to start the kōrero in the community during our engagement. The foundation of the framework is people, he tangata, and place, and overlying the entire framework is a consciousness to ensure there's equity and sustainability of wellbeing and outcomes. What we have up there are 8 determinants which have been selected as starting points for our conversations during engagement. These are areas our trustees believe are priorities for our community and are only our initial conversation starters. The engagement exercise allows for deeper conversations to be had, and we're listening. Next one. So up there is pretty much a snapshot of what we're going to be making available at the end of this week on our website. That's the literature review, the horizon scan we talk about in terms of the frameworks and models we've explored. And I guess underlying that, the exploration of those frameworks was to look at the appropriateness of what they have to our region. And I think it probably leads us to the point of why we're looking at more of a Tairāwhiti centric model. I'm going to hand it over to Erina.
So with our research complete and available later this week, as Aud has just said, we're now earnestly into our engagement phase of the project. And it's not rocket science. Our research has told us that the more people have a say in our rohe, the more likely our final framework will reflect the actual wellbeing priorities of our Tairāwhiti region. So I just thought I'd go over some of the key aspects of our engagement process. Firstly, it takes a lot longer when you aim to co-design a wellbeing framework. We are going for an engagement process that spans just over 6 months. There is a lot of emphasis during our engagement on building trust and building relationships with people. Our communities and our iwi are fatigued when it comes to engagement. Over the last couple of years, our communities have been asked to engage a lot. So we try to gather existing information from engagement that's already taken place. We have narrowed our engagement down to 3 basic research questions. Our first question simply asks, what does wellbeing mean to you? Our second question asks, what factors influence your wellbeing? And our third question asks, if you were to notice positive community change, what would it look like in 5 years or 10 years to you? We're doing a variety of engagement styles. We're doing one-on-one interviews. We're doing focus groups of up to 6 to 8 people. We're doing an online survey. We've created like a pop-up stall for any existing community events that are happening this year. And we're also looking at street surveys and possibly a telephone survey. We're really trying to make local connections to our central government agencies here in Tairāwhiti, because as we know, there's a national agenda for wellbeing. And we just want to make sure that our local Tairāwhiti wellbeing framework talks to the national frameworks. Just to give you some examples around our engagement process, we're currently collaborating with Year 12 health class to lead out student-led engagement. They have an achievement standard, NCEA Level 2, on community wellbeing. And to achieve credits, they have to address a community issue, they have to come up with an action plan, they have to implement it, and then they have to evaluate it. So our community engagement phase aligns to what they have to achieve, and our benefits are reciprocal. They get an opportunity to complete their credits with a real-world project, and in the process, they really help us to lead out student-led engagement. What we ask of them is to gather the voices of young people that might not talk in any other space. To get to this point, however, I just want to emphasise it takes time. So for us to even start to talk to students, we've had to go through a number of processes to build relationships. Firstly, with principals to introduce the project and to talk about what our intentions and our kaupapa are. From that, they connected us to teachers, and so we talked to a number of teachers around the project. And from that, we found one teacher that was really interested and felt that it completely talked to their achievement standard. And from that, we've had 2 meetings with the teachers, and now we've had 2 meetings with the students. And for the next 5 weeks, they're going to do and lead out their engagement process for us. So I just wanted to emphasise that some of our engagement processes do take time, and a lot of it's about building relationships. Other examples of our engagement. So we've really chosen to go and start our engagement process with talking and introducing ourselves to people. We've presented to iwi chairs through Te Hurihanganui Tūranga Kiwa to get feedback on what they thought of the project and how best they thought to engage with marae and whānau. We're in the throes of holding a City Centre Vibrancy Business Network session to introduce ourselves there and to really encourage our business sector to come forward and speak to wellbeing and speak to the wellbeing of their business and their staff and networks. We're organising focus groups with the Farming Women Tairāwhiti Network, and we've also connected into Project Mataro, which covers 6 communities along the East Coast, who have actually well and truly been doing community research around wellbeing and community planning for their communities. So have your say is the catch cry for our engagement. We want to go across the width and breadth of our region and communities to hear what wellbeing means to us all. As part of this, and as Audine mentioned, we've got our framework, then we're going to create a distribution decision tool, and this is a tool that helps and informs the decisions that our trustees make around how best to look at enhancing wellbeing in the region. Capturing good data, managing and coding it in a system that allows us to then synthesise and analyse the information comes next. In order for us to start to even co-design a Tairāwhiti wellbeing framework, we have to have this type of system in place. And so our engagement phase has also included building relationships with potential support partners like the Social Investment Agency and the Health and Wellbeing Research Centre at Victoria University. Together, we hope to build a strong, evidence-based process to come up with the final co-designed creation of a framework for Tairāwhiti. And as we start to do that, we'll also start to develop the distribution decision-making tool that goes with it. The last and final phase of our project is also looking at impact measurement. What we measure, of course, is firstly entirely dependent on what is prioritised through engagement as it appears in our final framework. And we acknowledge that measuring impact takes time. We are committed to taking a longitudinal approach to measuring impact, and what that might start to look like is coming up as part of our timeline. Secondly, what we measure will either be through open data sources that we can access, and there are numerous sets of indicators and measures already created to assist in this process. But thirdly, and I guess most significantly for our trust, is that there will be a set of measures that will be created that may be quite unique to our region and quite relevant to what our communities believe is important to measure. These indicators may come through our engagement research when we ask our question, if you were to notice positive community change, what would it look like over time? The other part of this process may also be guided by what the trust invests in. It may require us to support our communities to gather data and information through surveying and tracking different types of information over time for the duration of the project and beyond. Also important to mention is we, as part of our engagement process, are also starting to align ourselves with various groups and stakeholders in our community that are already capturing information and data based on their own projects. And we're hoping that we can, over time, build up a real good picture of impact across our region. Remembering that measuring impact supports us to do either more of the same thing, change tact if it's not working, or incrementally improve over time as more data comes to light. So my main key message there is measuring impact has a longitudinal commitment and is informed by the underpinnings of a circular economy, which is something we are keen to hear about.
Okay, so as an organisation, we're already looking at ourselves and so wanting to take steps to working in a circular economy. So just up there are some other organisations we've chosen to, organisations and kaupapa really, that ECT has chosen to align ourselves with. And I'm sure you may have already heard from some today or later on in the program, but I think, you know, as an organisation going about this wellbeing piece of work, it's certainly an area we want to move towards too as an organisation in terms of how we're approaching this. So Erina and I are really happy to have further conversations while you're all here at the hui or whenever the case might be that you might want to catch up with us. But thank you for allowing us to share this kōrero with you today. Kia ora koutou katoa. Tēnā.
Kia ora.